yeah?
Yes, fine. Hi everyone, good morning. I'm here with Kumaran this morning. I hope you're all doing really well. Kumaran is a recent starter with us. We've been trying to get his name out there as much as we can. We're delighted to have him working with us for the foreseeable future, hopefully forever. Massive Manchester fan, so I imagine he's going to be here for a very long time, which is great. Kumaran is an expert when it comes to sports and chiropractic, but not a lot of people know about sports and chiropractic and how it works in harmony together. So Kumaran, take it away, tell us everything that you can about sports and chiropractic.
Hi everybody, I'm Kumaran. You know, sports is my thing. I'll talk a little bit today about how you can recover faster from sports and how chiropractic works in it. So I'll use a simple example. You played a football match, gone into extra time, gone into penalties. It doesn't work out that well, but your body needs to recover. So as a chiropractor, I worked in various football teams, rugby teams, really hectic sports that involves a lot of contact. And a lot of athletes, they end up getting injuries that they don't realize. Short term, medium term, long term. So what sports chiropractic does, it helps with the recovery rate. And how it helps with the recovery rate? Let's take an example. You have somebody who's a left wing and is running the entire match, but he doesn't do a proper warm-up, he doesn't do a proper cool-down. So generally with these kind of athletes, the next morning they'll be stiff, they'll be achy. So what I tell my athletes that I coach, come to the clinic within 24 to 48 hours and you have to realign your spine. The reason being is, especially in football, when there's a lot of contact, when there's a lot of running, stop, start, your joints, they actually move slightly out of position. Maybe it's 1 millimeter or maybe 2 millimeters. And the big joints, especially in football, is your lower back joints, your lumbar joints, your sacroiliac joints, your hip joints, your knee joints, and your ankle joints. So when you are regularly assessing an athlete, when you're seeing him regularly, you kind of learn his pattern. You see, okay, maybe he kicks more with the right leg or more with the left leg. You'll find, and this is what the research shows, that the hamstring will actually shorten a little bit. Maybe 1 millimeter, maybe 2 millimeters, maybe even more. And that particular athlete will complain of sometimes hamstring tension, gluteal tension, and they'll always have a little bit of lower back stiffness. So to get them recovered fast, because normally if you're having a pro athlete now, example, who playing for Manchester United, the training is very intense. The recovery is very short. Especially with COVID, they were playing Monday, Wednesday, Friday, 3 times a week. So what's the aim of a sports chiropractor? And what my aim is for my athletes is to get you to recover faster. And how we do that? When the muscle, example the hamstring, it shortens a little bit, that in effect will make the joints in the spine, the entire spine, not just the lower back, and the hip joints to close. And when they close, they cause friction, which will cause inflammation and may lead sometimes to pain. So if you can create that optimum space in the joints, that's the aim of the sports chiropractic, creating that optimum space. Then you reduce the friction, you take away the swelling, the pain, the inflammation, the hamstring lengthens back to its normal state, and the athlete can go back to training and start getting back into the normal routine. So normally when I have especially football players that are coming in to see me and I'm coaching them regularly, training them regularly, their frequency is sometimes once a week, or sometimes even if it's a high intensive league that they're playing, sometimes twice, just to check, is a leg length changing, is a shoulder length changing? Because ultimately you want to make sure that your athlete is at peak performance all the time and not having injuries that is chronically occurring. And the common ones in football, always hamstring injuries, groin injuries, quad strains. So let me know when you want to come to the clinic. You got our number, call in. Even if it means you have a child, 8 or 9 years old, he's got a trial at Man United. Let him come in, let him check him out, let's screen him. Because sometimes kids have got scoliosis. You don't actually realize the spine is twisting in a 3-dimensional fashion. You can prevent injuries and make that child to be the greatest footballer England has ever seen. See you later.